going to be talking about inflammation. First off, I want to go over whether inflammation is good or whether inflammation is bad. Because I know that there's always been some sort of confusion, at least personally, whether we want inflammation to occur or whether inflammation is negative and we want to suppress it. Inflammation is your body's innate mechanism to destroy pathogens or to prevent the spread of infection and to begin tissue repair within your body. So initially, the innate responsibility of inflammation is actually very positive, right? Although inflammation can be bad, however, if it is done in excessive amounts. Excessive amounts could lead to tissue damage within your body. If there is some sort of vital organ being compressed, so brain swelling is a good example of negative inflammation. Meningitis causes negative inflammation because it inflames the membrane surrounding your spinal cord and your brain. So obviously, any sort of vital organ that is getting compressed from inflammation can be very negative. Systemic inflammation is also very bad because this causes vasodilation throughout your body, causing an immediate drop in low blood pressure. Septic shock could occur. There are a lot of negative side effects to inflammation if it is done excessively, but overall it is a very positive process. Major events of inflammation first off occur through the release of chemicals such as histamine, which will kickstart inflammation to occur. Next up, a clot will form, either walling off the microbe if there's a pathogen, or it will prevent any bleeding. So that's what that initial clot will do. Secondly, your blood vessels around the infection will start to dilate so that more blood can enter into the inflammatory or inflamed area. This is what causes the initial redness. When you think of something getting inflamed or on your skin, or if you get a cut or something like that, that redness comes from the dilation of your blood vessels in that targeted area. Another thing is that your capillaries become very permeable as well. So a lot of fluid will leak out into the targeted area, and that is what causes that initial swelling, kind of tenderness feel from inflammation. Next up is phagocyte migration. So margination happens. Margination is when the phagocytes, so immune cells, will react via chemical stimuli, so chemotaxis. Phagocytes will go up to the inflamed area and they will stick to the blood vessels around the targeted site. Diapetesis will occur. Diapetesis is when the immune cells, so the phagocytes, will squeeze through the endothelial cells into the tissue and to the pathogen of the inflamed area. It'll squeeze through the endothelial cells of the blood vessels in that targeted site. That is diapetesis. Phagocytosis will occur, so neutrophils, macrophages, they will clean out whatever pathogen is there. And then lastly, tissue repair will occur. Macrophages and fibroblasts will release a growth factor to repair the connective tissue within your body around that targeted area. Overall, inflammation is a fairly simple concept to grasp. It is, again, very positive if it is done in moderate and appropriate amounts, but it could really go either way. But I hope I made this super simple to understand, and I hope everybody was able to learn something from this.